Then go up to the top where it says recording and just pause it. Pause it. Okay. So now, oh wait, it's not paused though. Is it paused? Let's do our recording. Okay.
So the lead testing.
I guess, you know, it's so interesting. It's like you're killing them. And it's much based on like how they don't understand how their parents sort of condition them as that, stuff like that.
Okay, we've got 4:30, so we're going to call this meeting to order. The second item is adoption of the agenda. It's recommended the Board of Health members adopt the agenda for August 17th. May I have a motion?
So moved.
A second?
Second.
Any discussion? All those in favor say aye.
Aye.
All those opposed? We have adopted the agenda. Number 3 is approval of the minutes. It's recommended the Board of Health members approve the minutes of July 20th, 2022. May I have a motion?
Motion.
A second, please?
Second.
And is there any discussion regarding the meeting minutes?
A couple of minor things. For new business, where they talk about the nominations, could we just maybe include the first names since they're not anywhere else? It's just a little more specific, I thought.
Could you give us is there a page number?
Oh, it's page 3, I think. Okay, I think Dr. Hellenthal, Ronald Hellenthal. I just looked at the packet. Mr. Jeffers, David Jeffers, Miss Pontius, Sandy Pontius, just add those. I know it's a real quibble, but in the matrix, I'm a Mrs., not a miss, on the last page, right there. So,
Okay,
yep, but otherwise, that's it. I mean, I just, I thought maybe being a little more specific on the names would be helpful. Okay, for identification.
Also, I think I asked at the last meeting about all the emails and stuff, how those would those be part of the minutes? So I assume
They are.
So I assume the solution is just to kind of list them.
That is a solution. If you want something different.
No, I just was asking if that's what you think is best.
Yeah, so all the emails obviously were sent to all of you guys, and then we've got a summation of what was sent in. Included.
Actually, can we ask a question about those, or is this not the appropriate time?
I think it's appropriate time. Yeah.
Those 58 emails that were received on Wednesday, July 20th, were they form emails?
I have no idea. I got those numbers.
On July 20th, the 58 emails, were they similar?
There were quite a few that were similar.
Okay.
They were all sent to all the board members.
I didn't see 58. Maybe I missed that. Were they all sent? I'm sorry, I missed it. Okay. All right. Thank you.
All righty. Any other discussion? Okay, the additions or the additions that Ellen mentioned. Let's take a vote to accept the meeting minutes. All those in favor say aye.
Aye.
All those opposed, the ayes have it. We have approved those minutes with a few additions or changes that we will make. Number 4 is the board president and announcements. And there were 2 items that I wanted to just highlight and really lift up. Inside of our meeting minutes were was highlighting the 2 videos that have been produced and released by the Department of Health, and that they've had over 8,000 views now on those 2 videos, which is just amazing. So I just want to shout out, because we've not had anything like that in the past where we're really able to showcase what it is that the health department is doing. And so I think that's an amazing job. Well done. I also wanted to thank Sally Dixon and her team to getting the quarterly community action update that was on August 4th. Thank you for doing that. It was well attended, super informative, great data was shared. And I love the fact that community members came on to share all of the things that they were doing. So there's this real opportunity then for connecting and collaborating. And it was super evident. Everybody's on a first name basis, which is awesome. So it's clear relationships have been built. And you guys are working together to improve infant mortality and maternal mortality in our community. So I want to give that shout out as well. And then number 5, moving on, is the health officer's report. So I will turn that over to Dr. Bob.
Thanks, Heidi. You should have all received the report. There were a couple of areas that may appear anomalous to you and some that should appear mistaken to you. So let me point those out if I could. On page 13 on the environmental report, under complaints and investigations, you'll see complaints and investigations F, other. You'll see July 2022, 157, which exceeded the entire amount year-to-date in the previous years. And what happened here is that the environmental team does yearly inspections of the wells at Jude Creek due to prior salt contamination. And so they do chloride assessments here on a yearly basis. And these happen to be put in this time under other. And they had not been put in under other previously. So the numbers are actually correct. It's just that we had not included them in previous reports. And so that's why that's there. And today, Brett will give the presentation on behalf of the environmental team, and he will go over the Jude Creek issue with you. On page 38, the ACE presentation, it may appear, you'll see we put ACE presentation effectiveness, but then there were 0 ACE presentations. This clearly the ACE presentation effectiveness simply related to a total accumulation over the entire time that we've been reporting on the ACEs, and so there were none. Nothing changed from last time. So really nothing there. You'll note on page 40, the HOPE report, if I'm going too quickly, just let me know, has changed somewhat. And Robin, in the HOPE report, at the very top of the report, listed the total number of releases by the Department of Health, media stories, total number of posts, et cetera, breaking them down by media engagement, social media, substance abuse, and suicide. And so this is a little bit different from what you have seen previously. And we thought it would just be a little bit more illustrative of her work. And so if you want us to continue that, we'll be happy to do so. Robin will be happy to do so. If it's of not value to you, just let us know. I'm sure Robin will be happy to turn her attention to other matters.
I liked it, I'll say. I liked seeing all, like, you know, how the department is in the public eye and how you're putting yourself out there. I think that's great.
Can I ask a couple of questions on the, if we're talking about it right now, on the meaning of a couple of these things? So social media, so you have total reach. So that's the number of unique people who you can track, unique IP addresses or whatever to see your posts. And then what does total visits refer to?
That is individuals that search out through a social media platform, the Department of Health.
Oh, okay. Okay. So that's amazing that you can track that, but I'm not good. Okay. And then I think there's one quibble. I think the essence alert, I'm assuming that's referring, there's like a star there. That's referring to an abnormal number of suicide cases, right? So,
Well, it can be suicide or substance use
Okay.
is essence.
so that goes in the substance abuse category, the little
The stars in
the
the wrong
stars in
place,
the wrong
that's all.
spot.
Yeah,
Okay.
that might have just been where I missed. I meant, in case somebody was looking for what an essence alert meant.
Oh,
Essence alert is when there's an abnormal number of whatever
Okay.
we're tracking.
Yeah, you're right,
Okay.
you're right. It goes with total reach.
Okay.
It should have gone to the other one.
okay, but there were none, so that's good.
Yeah.
I'm assuming that's good, that there were none.
Yeah, it's
Yeah.
good.
Yeah, okay.
The essence alert, what it does is it, and Robin can explain it better than I can, but essentially, if it's significantly out of different from baseline, then we get the alert.
Yeah.
But unfortunately, the baseline substance abuse continues.
So then the way to
Unabated.
interpret the suicide one is that there were 4 times during the previous 30 months where it went out of
30 days.
sync.
30 days.
30 days, what did I say?
Yeah.
Okay,
Right.
30 days, but there were 4 instances where it went away from the baseline.
Correct.
Okay,
Correct.
okay.
Significantly so, and I don't recall, Robin, what how much out of baseline, what percent it is that.
It depends on the
Yep,
day.
exactly.
So like ER visits, there's an increase of ER visits on the weekend, so your baseline's higher on the week. So it's depending on the day.
Oh, yeah, okay.
One other question, now thinking about the media stories, have you ever thought about when the Department of Health is in the news, if there's a media story, just sending the board an alert, just telling us? Because some of these, I mean, you know, I don't go to all of these sites, so I know some stories, but I didn't realize there were, how many is that, 20?
It's a lot of stories.
15? 14. Yeah. So just an idea, maybe, just to alert us and. Good idea.
Nice.
We always know when they're going to do the stories.
We don't, however, that's something we can ask them to alert us when the story is published. Sometimes we'll ask to see a story before it is published to verify context. But
Yeah.
that's something we can add. That's something we can add. and ask.
Something you or Jenny would do.
Something I'll do.
Okay.
Yeah. Because most times I prep them, like we ask for questions ahead of time and then sometimes we ask for the read before it's published and then most times they're good and they'll say this will air on the 5 or 6 o'clock
Okay.
news. So that's fine. I can easily track that.
Yeah, because nowadays, I mean, I don't watch a lot of television, so if I'm looking for a news article or a, you know, that's coming off one of the TV stations, I usually just go to their website and there's usually a transcript of it.
So you can even tell us afterwards.
Yeah.
Yeah, exactly.
Yeah, see it afterwards. That might be easier.
Yeah, that would be a lot. Yeah, and not, yeah, we don't need to know ahead of time that it's coming out, just.
Yeah.
Be nice to
Thank
know.
you.
On the board, what other questions do we have for Dr. Bob about the health officers
Did you have
report?
anything else you were?
Yeah, I'm sorry.
He was in the middle. of telling
Okay.
us.
The, on page 43, and this is something I should have said last month, the month before for that matter. The data that we're particularly comfortable with is the monthly data. The monthly data that I showed on July of 2022 is correct. The year-to-date is very messy data, and I encourage you not even to try to make sense of it. We're going to be working, it's just not been a priority for us, but we're going to work on making a little bit more sense of this. The reason it's so problematic is that you'll recall that we gave a lot of COVID vaccines and it was at Hedwig Center, and then we left the Hedwig Center and we started giving COVID vaccines downstairs, and trying to tease out COVID vaccines from regular immunization vaccines, you would think would be a simple process, but unfortunately it isn't. So I would encourage you not to put too much stock in any of the year-to-date data, but the monthly data is accurate. And I'd be happy, or Cassie and Jody and I'd be happy to try to respond to any questions that you have. Bottom line is the Mishawaka Clinic, unfortunately, because of the recent resignation of one of the nurses that we've been unable to get the Mishawaka Clinic up and running again.
Oh,
And anywhere beyond just 2 days a week. So it's frustrating, but that's the reality. And then I just wanted to mention a couple of things that are not in the report because I think it's important that you all are up to speed on some of these. One, now as opposed to waiting for next month when I report on what happened in the month of August. First, you may recall that we, the Department of Health, are responsible for convening a group of individuals who are responsible for trying to bring up the behavioral crisis facility that's going to be housed by Beacon Memorial / Epworth Hospital. We continue to do that. Lori Miro, who is here, is spearheading that on behalf of the Department of Health, and we have monthly meetings with a group of high-level group of individuals responsible and who are stakeholders, including representatives Sheriff Redmond, Oak Lawn, Memorial Hospital, and others, community members as well represented. So that is moving forward. It's moving forward a little bit more slowly than any of us would have hoped, but the bottom line, it is moving forward. And I do expect to see visible progress in terms of renovation of the site, and with the hope of actual operations by the end of the first quarter, early part of the second quarter of 2023. So that's that. The second thing I wanted to apprise you of is that Mark and I remain, Dr. Fox and I remain keen to try to begin an initiative focused on cancer prevention and control. Just a reminder, if one measures burden of illness by mortality as opposed to disability adjusted life years, but if you measure burden of illness by mortality, the two top causes are heart disease and cancer. We have not been as attuned to the matter of cancer control, in part because the data and the evidence for what a local health department can do in terms of health control is, in terms of cancer control, is relatively limited in what we as a local health department can actually do. But I think there are some things that we can do, and we're going to at least give it a shot, and particularly focused on cancers that are preventable. So this would be head and neck cervical cancer, certain head and neck cervical cancers that are HPV associated, colon cancers, breast cancer. And so what we're looking at doing, step back, we actually had an intern in from Wabash College work with us over the last 2 months, worked particularly with Cassie and our immunization team, just beginning to think about how can we be a little bit more focused on HPV vaccine as kind of a model of cancer prevention. And then we had written a grant that honestly wasn't, I thought, the best grant that I had ever written in the world. And I wasn't very optimistic it would get funded, but wrote that to CDC. In fact, it did get awarded to us. And so they're going to fund one individual who is bachelor's trained, fund that person wholly for 2 years. And we're going to put that person as, if you will, the point person, not quite at the level of project manager, but they can get to that point of project manager over 6 months or so. And put that person on a team responsible for coming up with developing a strategy for cancer prevention countywide and then implementing that strategy. For it to work, it will require good collaboration among the various hospital systems, particularly South Bend Clinic and St. Joe and Beacon. But I think that with the unified command that we worked so well together during COVID, I think there's a reasonable chance that we can get some good collaboration. And then with the recent funding from ARP for the social behavioral scientist or scientist team, you may recall that initially I thought that we might be able to hire somebody internally here. We didn't have great candidates for that. And so we're looking to Notre Dame now to fund a socio-behavioral scientist wholly or a team to help with this initiative, and other initiatives, whenever there are questions that arise relating to the social behavioral determinants of health, and we need help in assessing a particular problem that we think is due to a social or behavioral issue, we will bring the team on board to do some sort of the Notre Dame team on board to do a rapid assessment and help us in coming up with solutions, identifying the problem more clearly if need be, or coming up with solutions. But bottom line, I'm envisioning this cancer control initiative being a team approach with the Notre Dame coming in, working with particularly the HEED and the HOPE team with this new individual funded by CDC, and then trying to pull together the various health systems. It's a little bit ambitious, but it's very, I think it's doable, and we'll just we're going to give it a shot and see what happens.
Wonderful.
Kudos.
So,
That's outstanding. How much is that grant worth? The CDC grant?
well, they don't put a dollar amount on it. It's
Because they're
because they
giving you a
fund the
person,
individual.
right.
And technically, this individual will remain a CDC funded. So it's not on our dime. It's all on CDC dime, but it's kind of like the individual. Oh, and I should have mentioned 2 of our Notre Dame fellows, who you recall are all master's trained and now have 2 more years of experience under their belt. They're staying on with us. And so they as well will join with this team, and they will be funded no longer by Notre Dame, but by us. And so we're really developing this really terrifically robust team. But this intern funded by CDC will be akin to what the fellows had been funded by Notre Dame, because our fellows were Notre Dame, technically Notre Dame employees, but completely embedded and responsible and responsive to the line of authority went really to Cassie and to me. The intern is going to be the same way.
Super excited about the partnership with CDC. I know a little something about that program. That's how I started at CDC.
Oh, really?
Exact same way, except I started at the Chicago Department of Health. Yeah. It's an awesome program. It's fabulous. Dr. Bob, anything else?
No, that's it. I'll be happy to take the questions, any questions that you have on any aspect of the report.
I have a few comments.
Go ahead.
Yeah. So just looking on page 42, I wanted to point out that apparently Sally co-led the regional FEMA coordinator meeting with FEMA coordinators across 5 states. And I want to say that's a real big deal. That was a lot of FEMA coordinators, and you co-led it here. Yeah. So that really speaks to, you know, your success as a FEMA coordinator and what the program has been accomplishing. And so I want to say that's wonderful. Also on the same page, I followed that link that you highlighted up at the top of the page for the Ask the Women project. And I just want to say this is heartbreaking, just reading about all the unmet needs of pregnant women in a state that has such a huge financial surplus, and we just can't get it together to support pregnant women for workplace accommodations, alleviating the burden of cost of housing, food, diapers, and childcare in a state that has a huge surplus. I wish that we could, you know, see that, you know, really, instead of just talking about it, actually doing something about the needs of pregnant women and families with young children. And then I had a question for Carolyn. I thought this was interesting on page 33. The vendor, only one vendor in the 4-H fair had 100% compliance on all the food inspections. Like, how many vendors were there, and like what kind of violations were you seeing? Like, how many violations? I mean, it sounds terrible.
No, it's 100%. So if they just have one thing, then they were
Cut out. So only one vendor like made it all the way through. But like, what kinds of problems did you see?
Temperature, hand washing, generally those are the things that are seen the most. I don't have it in front of me.
Yeah.
So I'm sorry, I can't tell you, but yeah. The one vendor was. Yes, him, yeah. Pediments, yeah. He's the one, and the truth is, he's every year, he's the top.
What does he sell? Tell us so we can all. The one that does well. Oh, the Netherton steak, like the steak chips.
They also have that drive-through.
Yeah, they have a drive-through on Great. Yeah, wonderful.
Well, kudos to him.
Yeah, good for him. We should all patronize his business then. That's really good.
I actually was curious about this too, because the fair lost power on Wednesday. Did that cause any major problems? We were actually at the fair when it lost power with our kids and
Not major problems because many of the vendors had generators.
Okay.
The fair scrambled to get generators for others, and some on their own didn't have generators threw their product out and didn't serve.
yeah, there are a lot of shutters for a while, so.
Nice. And then I had another question. Do you have a sense of how many people are unhoused in this county? And can you tell us a little bit about like opportunities for instance, community health workers to engage with them about their drug use and other needs?
The chronically unhoused is in the 500 to 600 number. And in terms of opportunities, first I would say that finding housing is one of the real challenges for our community health workers. It's really very frustrating for them. It is not an infrequent problem for them to have clients who are facing this, and it's a struggle. If you don't mind, Cassie, who meets with the community health workers on a regular basis, can also respond to your question.
Yeah, the biggest issue is for a lot of the community members that the CHWs work with are eligible for Section 8 housing, and they get a voucher. So if they have to be out of a home in a certain amount of time, they're given a voucher to find other housing for a certain amount of time within a certain time frame. But many of those houses or housing has an extensive wait list, and the voucher runs out before they can actually get into the housing, into Section 8 housing. And so we've been trying to be strategic. We work with the city and the county housing authority, but face many barriers, work with as many community partners as we can. The other thing with being in the state of Indiana and being a landlord favoring state, it's almost impossible to get an eviction off of your record. And so we also have that issue as well. Or a lot of landlords ask that you have to have the previous, the current, and the next month of pay up front to get into a home.
And the voucher doesn't do that for them?
There's some apartment complexes that say that they accept Section 8 vouchers because and this is where, don't quote me, they state that legally they have to offer it, but then at the bottom of the application process, it states that you have to have the current and the future month's pay, and they aren't able to come up with that in time. And I'll defer to Harry too, because I know you work with the CHWs a lot too. in that space.
And then at the Regional Planning Committee, this is a monthly meeting of leadership from all of the different service providers in town. This comes up every single month, that everyone has people with these vouchers, but there are not enough open spots at like apartment complexes and different places that take vouchers, or landlords, private landlords will work with them, to where this is a persistent issue across the board for all of the service providers with everyone they're working with. And it's preventing the flow of getting people out of shelters to get more people in, and it's compounding the problems that we're seeing.
Harry, am I right about the 500 to 600?
Yeah, that was spot on.
Including children.
Other questions for Dr. Bob?
I talked about this real quick, but
Yeah.
are the displaced people working people? Or are they people that aren't employed on any level and could not qualify for an apartment on their own?
I wouldn't say that it disproportionately affects one or the other. We're seeing it with people who are working or currently in housing, but that housing is tenuous and is a situation where they have to move out soon, so they're getting a voucher. Also includes disabled people. I would say it skews more one way or the other from my experience.
So if you're looking at like what could be done to, like, if we're not gonna remove the requirement from the apartment, like, and these people are, some people are making money. Like, can we help facilitate their process for saving money to keep laughing? It's like,
I'm sorry.
Get to Ramsey in here to like.
Because like, right, I mean, like I worked in a homeless shelter and a lot of the issues were, we had programming, but people didn't really know how to access the programming, or they wouldn't completely access the programming. So there were the mental health challenges as part of that too. So it's kind of like multiple layers of things. It's like, okay, well, they won't take the voucher, but why don't they have money? Because they don't have jobs. Oh, well, they have jobs, but they can't save money. Why can't they save money? Because they mismanage the money. So just like root cause analysis of like, what's the kind of, what are people's underlying issues?
Well,
They're
I
varied.
mean, it is so
They're so
varied that
varied,
it's
yeah.
so difficult to
Yeah.
pinpoint it on one issue. I was gonna say one thing that we could do to help alleviate this is just more numbers. We need more
More housing.
housing, period, that is affordable
Affordable housing,
and
yeah.
accepts vouchers. We need more either private landlords or larger housing complexes to accept these vouchers so that we can.
Now, I know there is federal funding for affordable housing, like and I don't want to take the whole time, but is the disconnect that people who could build affordable housing, I mean, there are even churches locally, right, that own properties that could maybe translate that to Section 8 housing, but if they're not connected to, they don't understand what Section 8 is, they don't know what's available to them. What can we do like to make some awareness of like, hey, there's funding if you want to get into the affordable housing field as a developer or as a church?
That would be amazing.
I defer to Harry because I'm not sure, or maybe Mark is also.
Marla has.
Someone stand behind you.
Marla wants to be in.
Contribute, yeah,
It's
please, go ahead.
Yeah.
Because that's my will.
Oh, please.
All of that is what you're saying is true. It's all being done. It's all there. People understand there's programs. They are being taken care of so that there's understanding of saving. There are people right now who have $4,000, $5,000, $10,000 in the bank. They don't have anywhere to live. There's people with jobs and employment and education. There are people with a 500 credit score or 850 credit score. They don't have anywhere to live. There are people who have 30 houses. I'm not putting no Section 8 on my house. So until people change their hearts,
That's the issue.
we're not gonna have enough housing. So churches, we've been to hundreds of them, all these churches. You know, Jesus, Allah, all the rest of them said, can you please help some people? Well, you know, you gotta take a risk. Oh, you. So
That's
thank
for
you for
public
saying that.
perception, which is what a lot of these things like the Wash Wednesday is like. So we're starting there with public perception and then trying to move.
And the mayor's team and all of us who work on these teams and the League of Women Voters and all the people who work on these teams, we all sit, there's a whole think tank and millions of people all over the world, including here in South Bend, that we all sit in these groups. And the people who have the power to open their doors don't open them. And so we continue to have people who are unsheltered, whether they have mental illness, whether they have a felony record, or whether they are these good old upstanding citizens with jobs and high credit scores and no records. They don't have housing. It goes from one payment to the next if no one will give someone a chance or change to allow vouchers, or the waiting list is so long that the voucher expires. Or people like say who do the working for that, hey, I have a job, I have a voucher, I don't have $1,800 saved. Whether I know how to save or not, I don't have a job that allows me to save like that. Can I just pay my rent? I just want to pay my rent. So it's a combination of things, and they're being worked on expeditiously, I would say, in this community in a lot of areas. There
Are
a
you
lot of
seeing any
different
improvements in any of those, or are we kind of like, oh?
Are you seeing what?
Like, are we seeing improvements? Like, you're doing all these
Yes.
things, are you seeing like,
Mhm.
is there some progress? Like.
There is
there's-
progress in a lot of areas, at least in the areas that I work with, I see improvement. But as you see improvement, there's still somebody else coming through the door. So it's,
One until to the day, right? So.
Mhm. And until like those people who own the 30 houses, they would just like, for a year, can you give us the vouchers, please?
Do we talk, I mean, like, I'm new, right? Do we talk to the city about, I mean, like, there are tons of abandoned properties, right? There are tons that go on auctions and all these things. I mean, are there stakeholders that are like?
So all that's being done, you gotta get on that committee.
I think I do. I'll talk to you after.
Okay.
Excellent.
Already has a comment.
Oh, yes, sir.
And just to build off what you were saying there, there are things that are being done. I know Ann Mannix is a contractor hired by the city to look into this issue, and her team have for some time been talking about and trying to build a landlord group where they can do outreach and make those connections and create assurances to people, things like that. And this is something that I've been keen on connecting with them with to see where they are in that process and try and push it along a little bit if possible. And then also, I know Pam Meyer and her team at the city are convening meetings with leadership from service providers about American Rescue Plan funds. I believe that's what they're from, where they're talking about trying to use those to, one of the things that we're talking about is refurbishing some of these abandoned houses, things like that. But they're still in kind of the planning stage, figuring out exactly how much of this money will we need for that, what are other things we could do to support. And so those meetings are happening, and people are trying to move the ball, but it's not happening as quickly as.
Nothing's gonna happen.
Yeah. So this is a persistent problem, and especially as the cost of living is rising. Unfortunately, we'll likely see more people slip into homelessness. So this is an issue we got to keep up on.
Teresa,
I was gonna say, I would add to this part of the conversation, you already alluded to the fact of the American Rescue Plan monies. So the Mayor Mueller gets monies from that, right? So the city got monies, Dave Wood got monies for Mishawaka, and the county commissioners got a significant amount of money. And we're talking, that's better than $50 million per. So I know somebody got a $75 million pot, somebody else got 50 million. I think somebody else got like 30 million, something like that. So I would be asking the question, how do those three entities come together and leverage the dollars and make it work? Because this is too old of a problem for us to even honestly still be talking about. Yes, Ellen, you have.
I think I have to actually request this of you, but the lady who shared her experiences, I did not catch your name or what you do. Like your position. I appreciate your comments. I just wanted to know. I wanted to know her name.
My name is Marla Godet,
Marla Godet. Okay. And what do you do?
I'm a mental health professional.
Oh, okay. Thank you. Thank you. Thank you very much.
You're welcome.
Yeah.
Teresa, I just wanted to, since you're new, I don't see our role as leading our being the Department of Health. We don't have the capacity or the expertise to lead in this space. But I do feel that we as the Department of Health should at least be at the table. And that's why we brought Harry on board several years ago. So he's at the table, community health workers obviously engaged. The data, one of the things that we've really been fighting for and unfortunately have not been able to affect is really getting a robust data set. It would start with a unique universal identifier for every individual who is homeless. And if we could go to that and then collect data, we don't really even understand the numbers of people moving in and out of this county, how long they're here, where they're coming from. And so there's a paucity of data. We don't have the capacity, but we will remain at the table, but do not expect to lead in this space.
Harry.
Just to that effort, there has been a data working group created at the regional planning committee. And I have been trying to push them to look at other systems for data collection. Right now, they're only using HMIS, the Homelessness Management Information System, which is what HUD requires them to use if they're getting HUD funds. But even then, within that, the main focus of the group has been cleaning up the HMIS data set, and that's been I mean, we've been doing that for like 7-8 months now and still having issues. And when I bring up trying to create something a little more robust with unique identifiers, right now, a lot of the conversation is like, well, let's just figure out how to use the thing we have well before we move on to something larger. So it's something we want to do, but right at this second, I'm not sure if we're gonna have the support of the service provider community until things get a little bit more cleaned up on that end.
Anything else for Dr.
Change gears for a second.
Yes.
Can you tell us about like an update on monkeypox? Because on page 45, it said we got 20 doses of the vaccine from the state. And 20 seems like a small number for a public health national emergency, which is what it's been called. So what's your impression of the numbers here?
And the numbers fortunately have not really escalated the way many individuals had feared they would escalate. And we continue to have relatively low numbers within the county. I believe we're just at 6 or 7 right now total. And don't quote me on that, so it has not exploded the way some people feared. That said, it continues to spread within the state. The vaccination, we have been authorized to administer the vaccine. We, the Department of Health, have been authorized to administer the vaccine to anyone who's been exposed to a known case of monkeypox, or to any MSM who has had multiple sexual partners within the last 2 weeks. And so we're able to give that vaccine. And the administration of the vaccine per CDC and FDA has changed such that rather than being 0.5 cc sub-Q, we can now give 0.1 cc intradermally. And so 20 doses of the vaccine have become 100 doses of the vaccine. If we can get 5 doses out of the individual vial, which we can't always do, we can sometimes get just 4. And if we're able to vaccinate all 5, use all those 5 doses, because they're only good for 8 hours. Once you puncture a vial, you have to use it within 8 hours. And so we have reached out to the various networks, social networks, to inform individuals who are at risk and qualify for the vaccine. The state has done similarly, can't even pronounce my names here. I remain guardedly optimistic, but clearly behavioral change needs to be a major component of the solution to this, and it's not yet clear whether monkeypox will or will not get traction and become endemic here within the United States.
Thank you.
Thanks. Hearing no, so, excuse me, Ellen. Yes, you need to ask if you're going, I was just going to close out that section. If you
Oh, I'm
have one
sorry, I
more
didn't
question,
realize.
Please.
Oh, okay, I have a few more questions. I didn't realize that that we couldn't just ask for questions as.
Well,
as we
according
always
to
done.
Robert's rules, usually all questions go through the board president, but we don't have that type of formality, but in cases, yes, it is customary for the questioning to go through the president.
Okay, I think we just started to talk at the same time, so, oh well. My question is, first of all, the health COVID crisis fund. I guess I'm just curious, I guess for a couple of reasons.
What page are you on?
It's on page 22. I just realized, it's a lot of money, like $550,000, but are we doing anything with that money, or what are the plans for it? Are there plans for it being used in the future?
Right now, much of these dollars are discretionary,
Okay.
and so yeah.
Okay. Are there?
We reach out regularly to the schools. We work very closely with the schools, as you well know from the last couple of years. But yeah, much right now is is discretionary. We have met the obligations by and large of this particular grant. And we're probably going to have some money left over. It does give us some flexibility, and
Okay.
it is discretionary at this point.
So if you don't use all the money by a certain period of time, do you just give it back, or is it?
No, this one
Under public
actually
terms.
can go to, and I'll have to check with, where's Amy?
Right behind you.
Right behind me. Will we be able to use this even for salary offset?
Well, this grant was deliverable based, so we did the deliverables were met. The funds come to us, we can use them as we see fit, they don't expire, they
Okay.
carry forward from year to year.
Okay.
So we could use it for salary offset, we can use it for anything,
Okay,
the health officer.
Yep.
okay. Thanks, okay. I think, had a, with the FEMA updates, there were a couple of places in the descriptions of the FEMA updates. Oh, I'm sorry, page 41 and 42. There are a couple of times where it says, please see minutes for extensive discussion about different platforms. Please see minutes. So on page 41, the very last line, they talk about FEMA community action and they say, please see minutes for extensive discussion about different platforms, depending on audience for this topic. And then there's another one on page, oh, here it is. FEMA community action, birth, equity, and justice. The third.
Why don't we ask
point-
Sally where the meeting minutes are stored?
Yes, where they weren't attached.
When I send it.
Where, okay, where are they attached then?
They're not attached.
They're not attached to that.
It's not part of my, it's not part of my report to this board. They are available.
And for
Yeah.
Robin.
Yeah,
Okay, so are we,
you can get them by request.
Yeah, by request.
okay, okay. So can I formally request them now then?
Yeah, so I think the one is for like the maternal mental health things we're working on, and then the other one.
Okay.
I could, you know what?
Yeah.
Yeah, I guess just send an email. I have a copy of what I sent, so I'll send it to you.
Okay, thank you. I was just wondering about that, about what they were talking about with minutes. So another thing I had that, and I guess this is a question that I have with the ACES project. So is it currently, because I was looking at that Nacho Space Cat fund, which seems to fund some of the ACES prevention, and it has it talks about miscellaneous expenses. Are these expenses what are being used? This is on page 38. I'm sorry. Are these paid? Are these what are being used to plan this ACES Day program? Are those the funds that are being used to fund it? Okay. And then, so there must be people. So the people working on ACES right now, are they Notre Dame fellows?
The people
Currently?
working on the ACES are myself and Robin and Cassie and Mark. And the person leading this is Frank Spacia, who is a fellow embedded by the University of Notre Dame.
Okay,
He will become funded by us, by our county health fund,
okay,
as the ACES coordinator beginning in September. So we have made you'll recall, Ellen, that and it's pertinent to this whole matter of communicable diseases. ACEs are associated with an increased incidence of non-communicable diseases, chronic non-communicable diseases, cancer being one of them. And so when we created the strategic plan 2.5 years ago, and I thought about, okay, what will we do about cancer and the chronic non-communicable diseases? I thought, let's just start at the very beginning, look at the root cause here, and see if we can't, as a health department, begin to be more deliberate in preventing adverse childhood experiences. And let's see if there is see what we could do to prevent adverse childhood experiences. And so we went to the University of Notre Dame with this proposal, and they embedded a fellow to be responsible for bringing up the strategic plan and implementing it, just like we're trying to do with the intern who will be coming on funded by CDC. Frank Spacey has done an amazing job in this space and and will continue to spearhead this over the next year.
So he would be funded, so the Health Trust Fund has an ACEs coordinator position?
Correct. So he'll be
That's on
funded-
page 24.
So that's where we'll use that trust
Okay.
fund dollars to fund him.
Oh, okay, okay. No, he is the only person coming on to work
There's
with
two.
ACEs. Or did you say there were, or is there another public health fellow that's doing something else?
No. He'll be the only one. He is the coordinator, but ACE is cut across so many areas here. And so the community health workers, for example, will be trying to engage in some of these and be responsive to some of the issues that might arise. Some of it relates to what Robin does in terms of health education and health promotion and information out into the community, et cetera. He liaises with the school system, school systems, works very closely with them. Yeah, so this will be, it cuts across a number of different domains, units within our Department of Health.
I was just wondering where the salary funding is coming now that it's exactly what grants or programs it's coming out of. Now that it's going to be funded through the Department of Health. But thank you for the even broader update about what's going to be going on. So anything else, Helen? Oh, I think let's see. I think there were just a couple of so when we're talking about needs that are health related, on page 35. Yeah, on page 35, we're talking about the social needs assessments. I'm curious, so the 19 people had social needs and it's divided up into 53 total needs that they have. And then you have 5 general categories. Housing, family, health, financial, education. I'm assuming that you work kind of in-house will help them with the health needs that they have. And they're listed health insurance, immunizations, lead screening. I'm pretty clear about where in the department those things are dealt with. And it looks like Harry might deal with housing to some extent. But
actually, the community health workers do more than Harry does with this particular one, but they'll work together. That's correct.
Okay, I guess I'm just wondering to what extent with some of these other needs in financial areas, education, family issues, to what extent are you like actually taking on the job of dealing with those particular issues?
It's
or which
interesting that
seats
you
are
ask,
you?
because I actually had, I'm sorry to cut you off.
Oh, no, I'm just wondering to which extent do you just refer out? Because sometimes that's the best solution for the health department. If you've got a legal issue, you probably wouldn't refer to legal services or something.
Yeah, of course. And it's a little bit of both. So
Okay.
you're exactly right. What I was going to say was I came prepared to give some stories of what our community health workers are actually doing, but I was concerned about time. And the stories were fairly long. And so I thought I'd put them off until next time. But we'll do that next time, Ellen, and go through the stories. And I think it will illustrate very nicely just this incredible job that these community health workers are doing. But you're right. Sometimes it's literally, I mean, for example, I meet with them and listen to their challenges every Tuesday, I think it is. Every Tuesday I sit with them and listen to both their successes and their challenges. And it's just an incredible time. I encourage you to come and listen to them as well. But so, for example, yesterday there was, I have to be careful that I don't give out too much information because I keep forgetting around a public forum here, but an individual, young.
Marcel's gonna stop.
A young woman who had a particular medical problem. She struggled with the language. She misinterpreted what the physician was saying. The problem was a very real problem. And bottom line is the community health worker who also spoke her language went with them to the physician's office to make sure that they fully understood exactly what the physician was saying. And I had the opportunity to brief the community health worker ahead of time. It was a somewhat complex problem. I'll share with you, Ilana, afterwards what it was. You're familiar, if you will. And just was able then to walk them through what questions to ask and these sorts of things. So that would be one example. Other examples, Cassie, go ahead.
Yeah, I was just gonna say, all of the community health workers, they have a shared community resource guide that is an Excel document that's very extensive. And so anything that they aren't personally trained to provide service to, they then refer out. But the biggest aspect of a community health worker is that it's not just, here's a resource, now you go figure it out. It's, I'm gonna call for you and I'm gonna walk through this process with you. To kind of teach that accountability shift. And this is how you go through an application of something. Speaking of the legal services, we work with HealthLink in the Indiana. They have a medical legal partnership. So if you're a HealthLink client, you can utilize free legal services for evictions and all kinds of things. And so we have partnerships such as that, and the Notre Dame legal team does some pro bono work as well, so we'll do some referrals for that. And so we have very specific referrals in each of those categories that we've built relationships with, that our community health worker can call and say, hey, I have this, can we work together to work through this?
Okay, thank you. We ready to move on?
Thank you.
Thank you. Okay. So moving on to new business, we're going to ask Brett Davis to give us a presentation on the environmental health unit.
All right. Good evening, everybody. All right, let's talk about the environmental health unit a little bit. So what is environmental health? Environmental health is the science and practice of preventing human injury and illness by promoting well-being by all of the words there that you have in your packet. We handle all of the things that everyone's like, somebody should probably take care of this, but I'm not sure who. It's probably going to be us. Everything from mosquitoes to massage parlors to mega farms to a myriad of things in between. So now, last presentation last year, Bob had told me, brevity is the soul of wit, try and keep it short. And then I talked for like 40 minutes. And so now that presentation is the presentation that I give to everybody as part of their orientation. So rather than doing the full spiel of, all of the things that we do, let's talk a little bit about some of our specific goals and objectives. Some of the key things, we have lots of various different goals and objectives, very specific ones for all of our different subunits. But kind of the overarching themes are, we want to become increasingly modern, data-driven. We want to identify novel public health threats, not novel, just extra public health threats, and develop and facilitate some of our partnerships. So let's start out with modernization and data-driven. Our property transfer process needs some updating. Right now, we're in the process of reviewing how we handle property transfers, trying to update the form procedures on how we can better reflect the need for proper septic systems. Throw out some numbers at you. Last year, in 2021, there were 5,884 properties that transferred hands in St. Joe County. Roughly 1,776 of them were on a septic or well, and of those 1,776, 585 of them had some sort of failed septic components. 162 of them had some sort of failed water pole.
Oh, God.
So 33% of all the properties that transferred hands that were on well or septic had something amiss. And all of those things are something that our office we actually have to look at the inspection and figure out, is that something that we need to take action on? Is that something the homeowner needs to be aware of? We need to make a decision on all of those. That's a lot of work. That's a lot of work to do amongst all of the other things that we do. And so we need to figure out how we can better handle that. So that way we can stay efficient. That way we can better, stay on top of that. And so that way everybody is getting the proper septic system and drinking water that they need. We've headed to using more of the ArcGIS online. We're locating well locations for new wells that are being drilled, when we're abandoning old wells, when we're going out to do septics, trying to pinpoint where septics are. So that way we're not looking at schematics 20, 30 years in the future and trying to see if they actually put it in where they said they were going to put it in. Most schematics from, prior to 2010 or worth the paper to print it on. So we don't want that. We want, when there's somebody going out there to find a septic system, they can go and find it and address it. They don't have to spend forever and a day trying to find it. So that, as well as knowing where the well locations are, so that way if there is an issue with water quality and we start noticing a trend around it, we have data. We know where the well log is for this area, how deep there's a clay layer, all of that sort of thing. So that way we can better analyze our data and we're not spending forever trying to shuffle paperwork. Last year, I spoke to you about upgrading the permitting and database software. Right, our current system has lots of limitations. I'd say chiefly among them is the ability to digest data. That is one of many problems. The new system that we would like to have does have a public-facing portal, more transparency, so that way somebody can say, you're holding up our permit forever. I'm like, no. See, take a look. Your designer's had it for 3 days or 3 weeks, or whatever the case may be. On the flip side of the coin, if we have had it forever, everybody's going to know about it, and we can make sure that that doesn't happen. That open communication between everybody is key. That keeps everybody happy. It lets everybody know where things are at in the line, and if there are any weak points, we can address them. Public health threats. So the environmental unit is not complacent because we know that public health is not static. The public health is more than just the statutory requirements. There's a lot of things beyond just issuing septic permits or issuing well permits that we ought to be taking care of. So we are trying to use our resources and use our knowledge to go beyond just being, permitting rubber stampers. Last year, I talked about obtaining a ground penetrating radar. We got one, and now we're using that to go and find all sorts of very fun things and address all of those very fun things. One of them is illicit discharges. Fun fact, you can't just discharge a septic tank to a creek. We found a couple of those thanks to our ground penetrating radar. The NIPSCO gasification of Miami. For those of you that, I'll show you the picture in the next slide, but been around, so I've been in a while. You remember the big tower off of Miami and Lincoln Way that had the checkered top, the NIPSCO plant? That was where they did coal gasification. Shockingly, coal gasification is not a clean process. And so there's some residuals from that need to be cleaned up. And so NIPSCO is working with us, and we're trying to see if we need to do vapor intrusion monitoring on any properties around there, because that's really unfortunate for somebody who's just bought a house and something that they had nothing to do with is now negatively impacting them. Other public health threats, not statutory requirements, but things that we definitely need to address, be radon in St. Joe County, as well as vector surveillance. Both those I'll touch on here in a little bit. So there's a screenshot from our GPR. These various little points here, as we remove the GPR across the surface of the ground, it pings off of, oh, hey, look, there's something there. And so we can trace where those pings are and all the way to the creek. There's the gasification plant. And then the other public health threat is that I wanted to highlight is sodium chloride contaminations in water. So we're aware of the Jude Creek plume. It was mentioned during the annual report. So the former, see, is there a laser on this one? There's not. Up here, County Highway Garage, road salt contaminated all of those properties. And so we just conducted our annual survey. The maximum level that was detected for chloride was 520 milligrams per liter. The CDC MCL is 250. That is significantly down from the max since 2015. In 2015, there was one of the homes was up at 1100, which is not ideal. So that's the 2019 map. We don't have the 2021. I showed you the 2021 one last year. 2022, we're still in the process of making that map. But Roberts also does quarterly sampling. They do quarterly sampling, and then we do a big annual sampling event every year. But as of very recently, that's not the only sodium chloride plume in St. Joe County. We recently discovered another one where there was some folks that had been living at a house, and they decided to buy that house from their landlord. Landlord drilled them a new well as part of the purchase agreement, drilled a new well, and then all of a sudden, all of their water was super salty. So salty, in fact, that their chloride levels were 5,900. So 10 times what it was at Jude Creek. Turns out it was another improper road salt storage, this time not a government agency that did it. Hello? There we go. Back to life. So now there's a small amount of homes being impacted by that. We're in the process of trying to get that resolved. So there isn't a sodium MCL, but there is a chloride one. So we have to address the chloride. But for the sodium side of things, that property for the new one was 3,200. So if you're on a sodium restricted diet, that water is good for boiling pasta and that's about it.
What, can I just ask,
Sure.
what do you do about that?
So
I remember you talking about this last year, but.
Yeah, so in the 90s, when this first got figured out that this was a problem, their solution was to do some big desalination wells. They pumped it, they had big 8-inch wells, and they pumped out all the salt water into Jude Creek.
Killed a lot of
You
fish.
can't do that anymore. Well, I mean, it went through some various ponds on the golf course and things, but nowadays they're not actively contaminating the area. And there's reverse osmosis units on many of the homes now to try and bring that down. The reverse osmosis is not going to work very well for the new one. That's going to be like an industrial size unit to make that work, and it's going to wreak havoc on appliances and everything. That one there is going to need municipal water extension.
Well, that's better anyway.
Oh, it sure is. Yeah. Anybody and everybody that listen to me, I'll tell them, you need water and sewer extension desperately.
Yeah. Okay, thank you. Wow.
So one of our other goals is partnerships. Like I said, I'll talk to anybody and everybody. So the environmental unit's partnering with anybody and everybody. We were recently partnering with law enforcement, specifically the Human Trafficking Division. You may have seen it in the paper, the news a couple months ago about the massage establishments that have gotten raided. We're working with, we were working with them, trying to see because sorry, a little tongue tied there. We inspect massage establishments, and so we're working with them, identifying potential signs of things, that sort of thing. We don't want to be ancillary to the problem. We want to help facilitate, positive change. Mark has also been working with Robin, going to some presentations regarding the recent influx of synthetic drugs. You may have seen in the monthly reports that the clandestine lab occurrence reports are way down, meth labs. Great that meth is way down, but it's way down because there's new synthetic drugs. So trying to do what we can from that side of things to help out. We work with local elected officials all the time. The flavor of the day is South Bend Range. It's the abandoned factory out on Cherry Street, kind of over by Frankie's Barbecue, the old steel foundry from the turn of the century. Very slow process on trying to get that cleaned up. So we're doing what we can to try and facilitate that, make that better. We met with Mayor Mueller, with Councilman, with Commissioner Dieter, with IDEM, trying to help push that thing along. So that way it's not moving at the typical speed of government. We want to work at the speed of an environmental unit government, not overall government. The Area Plan Commission, go to every plan committee meeting, review every subdivision. BZA checks in with us if there's going to be something funky going on that may impact public health. The new county comprehensive plan, on multiple working groups for that, again, trying to push for sewer expansion, overall environmental quality, all of that sort of thing. And then a whole host of other things. Mark's a member of the Regional Water and Sewer District. We go to the St. Joseph River Basin Commission, Judea Creek Task Force meetings. We've got the Lead Affinity Group for all of that. We do presentations to realtors. We just got an email request today to do another presentation, another discussion with some home builders. Yeah, talk with anybody, open, transparent, and try and figure out how to make things better. So let's spotlight Radon, because this is a combination of all three things. The being data-driven, partnerships, and public health threats. So Radon is a problem in St. Joe County. Touched on this briefly last year. We had a bunch of data, but it was a lot of data, kind of hard to digest. So partnered with St. Mary's this year. They had a class, the stats and computational sciences class, partnered with them, and they analyzed our data and came up with some, digestible information from it. Based on their results, there's likely multiple deaths every year due to radon-induced lung cancer. There's roughly 3 people, non-smokers, who get lung cancer and die in St. Joe County every year due to lung cancer, due to radon. There's probably approximately 16 to 20 smokers whose lung cancer death was greatly exacerbated by radon. The overall mean test result from the valid test results was 3.25 picocuries per liter. For those of you who don't know what that means, that's the equivalent of 7.5 cigarettes a day. So we need to not let that happen. We need to figure out a better way of addressing that. We also need to get more testing done. Based off of their analysis, the best way to make sure we have good results is roughly 600 tests per zip code every 5 years. Or for the smaller zip codes, approximately 10% of households in small zip codes. Between 2010 and 2017, there was only 8,600 reported tests. And so maybe there's more tests being done, but we're not getting the results, or the state's not getting the results. We need to figure out a better way of getting these results and figure out how we can better address that. I recently bought a home and the realtor ordered a radon test without me asking, which is great. And the result, what's the result? And it's like, oh, hey, your radon passed. All right, what was it? It's like, well, it was less than 4, which 4 is like the you need to do something level. I'm like, all right, what was it? She's like 3. I'm like, that's not actually that great. Maybe don't just tell your clients that it passed and everything's fine. Radon's, it's like lead. Any amount is bad. Just because it doesn't meet a threshold doesn't mean it's good. So strategies like that. Figure out how we can do something with radon, because that's something that we need to take care of.
Like if you were to get, you're talking to the realtors, if you were, is that part of an?
And some of the realtors are know that, and they are working on things, and there are homes nowadays being built with radon mitigation units already
Yeah.
factored into it. It's easier to put it in when you're building the home than it is to retrofit it. Not that it's super hard to retrofit, it's just way more convenient when it's, just a foundation to deal with. But there's hundreds of realtors in the county, and just trying to, I mean, it's like all of the, I want to say all of the disconnects, but the disconnects and misconceptions about the property transfer process and the septics and wells. Trying to get everybody on the same page with that is a constant battle.
Or even just getting all the home inspectors to say that's part of their home inspection.
Yeah,
I know we had that when we bought our house.
yeah. I don't know all of the rules when it comes to home inspections, especially when the market got super crazy there for a while. People were waiving inspections. And so there's areas of the county where I'm not shocked when we get a test result that's 12. And so, I mean, there's probably people who are getting these homes with these issues that don't know. And so, yeah, that's part of our discussion with the realtors, is trying to, we do more than just well and septic permitting. We're trying to do the whole environmental health side of things.
What areas, maybe I asked you this before at our orientation, but I'm trying to remember, what areas of the county have the highest concentrations of radon? And
So-
are you focusing on
So
information?
46552 New Carlisle is
Okay.
almost far and away the highest. And that's what, based on from what I could tell, that's what it was. And that's what St. Mary's figured out as well. 46552 was greater than 10 other zip codes
Okay,
in St. Joe County. Their testing is not stellar, but the lows that are getting tested are pretty high. You can also see that Osceola 46561 is greater than 5 other zip codes, but they've got really good test results. So that's probably accurate. From what we can tell, because radon is not necessarily tied to, it doesn't have to be urban or rural. It's more just what the underlying geology is. Knock on wood, small victories, the densest population centers of, Meshawaka, South Bend, that underlying geology does not appear to be as radon producing.
Okay.
It's more of our outlying communities.
kind of the farm areas on the west side.
So.
What was that? 465.
Osceola 46561 has fairly decent testing, over 50% of their homes. But between the over 50% of those homes, they had higher radon levels than 5 other zip codes. So one of our other aspects that we do that's kind of encompasses everything would be the vector program. So since 2020, we've really grown the vector program. We now have partnerships with Notre Dame and Holy Cross, and we have an intern from Wabash College. I have a permit from DNR to do trapping at nature preserves, and we share data back and forth on that. Active in the Indiana Vector Control Association, actually the president right now. And we've increased our West Nile testing. We've got quick response. Quite proud of the fact that we can set a trap in the afternoon, collect it the next morning, identify and test mosquitoes the following afternoon, find out it's got West Nile, and then go spray for it that night. Find a problem, fix the problem 24 hours.
Nice.
Wow.
We're looking at infection rates, mosquito population density trends, and other development like that. We're looking at infection rates per mosquito per pool and that sort of thing, comparing our trends with the state trends when the human cases are coming in, trying to figure out if there's a way that we can, get ahead of the curve, so to speak. Excitingly, the new regional entomologist for the state has come from the CDC, and she has a very strong tick background, and I plan on leaning on that quite heavily because we have a hell of a lot of Lyme disease in this county. There's more Lyme disease in this county than any other county in the state of Indiana. And the problem is there's more than we know because the bullseye rash is quite easily recognizable by doctors, and doxycycline is really easy and cheap to prescribe. And so it is way easier to prescribe that and not have the test that goes into the data set. And then, so we're like, oh, hey, we currently have 9 Lyme disease cases. Probably not. There's probably a fair amount more than that. So trying, not coupled onto that, there's a quota on how many ticks that can be tested per year. So we're not actually, I mean, of the ticks that are being submitted, over 50% have Lyme disease. And so we're having to be selective about where we're submitting, where it's no longer let's see if there's Lyme disease, it's let's see where Lyme disease is. And so now we're having to select where our tick submittals are coming from to see if we can identify new areas where there may be Lyme disease clusters. So there's a fair amount of challenges that we have to deal with every day, but some of the ones that I wanted to highlight. So the lead level threshold dropped, which is great. We want to make sure everybody, is getting their proper, lead issue resolved. But the secondary issue to that is, since the lead level dropped, there's only so many lead remediation contractors. And so now they're increasingly busy trying to resolve all of these homes that have lead issues, which is prolonging said remediation of homes. I mean, it's a good problem to have that we're getting homes resolved. But this is a different side of the lead issue that, outside of the normal numbers, we're having a hard time actually getting it squared away. The state legislature had passed a bill, the 11th hour in March, that had a big impact on septic systems. Septic systems are quite a problem in St. Joe County, as you mentioned from the property transfer. Fun fact of the day, since 1970, going up until I pulled these numbers on July 1st, the Department of Health has issued 36,739 permits for septic systems. A lot of septic systems. This county has way more septic systems than it should. It's kind of bizarre to think about. You could be standing on Notre Dame property and you can see a wellhead for a residential home. I mean, that's nuts. But the state legislature has changed the law. So now we no longer have the authority to have a local ordinance more strict than the state code, which there are aspects of our code that, as a result of all the nitrate studies and everything is done, our ordinance has got a couple provisions like requiring a reserve area. That's not in the state code, that's us. That's what the Board of Health, gave to council and commission, they signed off on. So minimum sizing requirements, reserve area, piping standards, those are all things that unless the state changes their code, we can't enforce that anymore. Not only that, they changed it so if one county somewhere allows an experimental septic system, it's by default accepted throughout the state. If certain people, like if an engineer stamps it and sort of soil scientist stamps it, we have to accept it. So you get some county down in southern Indiana that's only got a part-time EHS that also does foods and everything else, and they don't know, and they go, sure, let's try it, and they approve it. The entire state now has to recognize that as a valid option. Not only that, if an engineer stamps a design and says, this meets all the codes, we have to accept it. If an engineer says that septic system's not failed, we can't issue an order of abatement to have it fixed. In theory, that would be fine, but just earlier this year, just a month or so ago, we had an issue where an engineer submitted a design that had 3 different trench bottom measurements. And so the septic contractor went to go put one in and it was too close to the water table because the numbers didn't match up. So, I mean, engineers are smart Engineers are smart people. But nobody's perfect. That's the reason why we're here. We don't go out looking for problems with septic designs. We're just trying to make sure that everybody's on the same page. And we're making sure that what's submitted is going to meet all the codes. And the state legislature has taken away parts of our oversight on that, which could create a problem in the future.
They're good at that.
We are currently short-staffed. Being short-staffed is not great. It hampers growth because, you know, the mental capacity and the space to try and do improvements now being diverted to, you know, filling in the gaps. You know, we were all set to be really great this year, and then we had 2 resignations in 2 months, and now we're looking into fall where everybody's trying to get everything done before winter, and it's quite a daunting outlook. And then again, the inefficient data storage and collection. Until we get new software, we're still trudging along with our junky database. So we still got that, but in summation, we are committed to providing the highest quality of work to protect the health of the public of St. Joe County. And we are doing so with quick action and constantly evolving tactics that best suit our county and its citizens.
I know we asked a couple questions during the session, but I'll open it up to the board now to ask Brian. Any other questions? Thank you so much for this.
Absolutely.
Very, very detailed and witty presentation as well.
I'm just gonna say, Brett, you're obviously so passionate about what you do, and we all benefit from that, and I thank you.
You're very well.
Board members?
I'm just curious, when you talked about partnerships with law enforcement regarding human trafficking, are you mostly working with the county prosecutor's office? That's page 56 of our packet, which might be different. When you're talking about, are you working with like county prosecutor's office?
It's really,
Or how does it work?
We get contacted by law enforcement agencies and we assist them as they request.
Oh, got it. Okay. Okay.
I was gonna talk about the training.
Sure.
Okay.
Here we go.
What's the status of a new database system? We've talked about it for years.
All dependent upon the county getting through its ERP. We're totally dependent on other aspects of the county government. We cannot move forward.
The on-site wastewater advisory board has met and has gone through. They also listened to the same presentation that we've had many times, and they are also supported. And so that's yet another agency that is behind us. But ultimately, it is up to the council and commissioners to open up the wallet to let them all fly.
The problem, John, relates specifically to the capacity of the IT department within the county, and it's woefully impoverished. The money's there, the people aren't. And I think there needs to be, and the political will, I hope, is there to make it happen, but it certainly makes one question. There've been some recent changes, and we remain highly optimistic that with the new change and the new leadership, within the last 2 months, if things will move forward more quickly and more efficiently and effectively.
So one last. No, you raised your hand. I was gonna make a joke.
I'm here, Jennifer.
The Dr. Bob said, be brief.
Yeah.
Last
I think I was brief.
Last year was 40 minutes. You did it in 35. So.
I tried. I only had 12 slides this time.
It was interesting.
It was very good.
The environmental unit is not the side that most people think of when they think of the health department. And, you know, especially, I mean, no offense to anybody on the board, but, you know, the MDs don't interact with this side of the health department as often. So.
But we're impressed by it.
Together. 2 days together.
Yeah, we did. Yeah.
We are impressed by it.
Yeah, I did. So the radon.
Yes.
So what are our thoughts about like reporting to the residents of these areas? Are there like, I mean, because your realtor told you because you asked her,
Right.
but so what are your thoughts?
So that was part of, within the depths of the papers that St. Mary's presented to us. One of the things I asked them to do was identify areas where we can concentrate our efforts, because ultimately we're a unit of 11 people trying to do all of
Right.
these things. And so, we can't solve, we can't solve everything all at once. And so we're starting out with, concerted efforts in certain areas. And so we do want to try and talk with different people in different areas and try and, like the New Carlisle area, try and get that addressed sooner than, south side of South Bend. Not that the south side of South Bend's great. I think they got a fair amount as well, but yeah, we are working on, we're hoping to use some of the data and the analysis from the St. Mary's groups as supporting data and a grant to get more radon test kits to try and distribute to the public, to try, even if we can't get the results,
Right.
or even if we can't fix it all, if the public is aware of it, they can take their initiative. That's still better than nothing.
Yeah, right. Agreed.
Okay. Thank you. Okay, so what do we have next? Old business? How the press releases are sent and the circumstances under which they are vetted by the board. So you'll see at the end of your packet, this is a policy that has been drafted, or procedure, standard operating procedure that was drafted by Dr. Bob and his team to address the issue that we were discussing last meeting and that we tabled to see if we could find a solution. And so maybe Bob, if you wanted to give some high level comments about what you guys drafted and how it's addressing that issue.
Yeah, I'm happy to do so. And to contribute as well, if what I say is not correct. So the issue that I sensed from the board last time was that there was some concern that releases, statements, activities, whatever, reports to others would be that we released, or I released as the health officer, and the department would release, would be interpreted as having had a unanimous approval of the Board of Health and would have been vetted fully by the Board of Health. That was the sense, that was my sense of where the concern was. I might have misinterpreted that. And so we among ourselves within the unit, within the various units and with the department, each of the unit directors looked at the various releases, the public health advisory, public health activities, educational briefings. Happy to share all this with you. So the abatement orders, required meeting, public notices, and Board of Health statements, communication. And so those are the different releases. So there was 1, 2, 3, 4, 5, 6 different types of releases. And we came up with a procedure that dictated which of those releases would be on departmental letterhead without any individual names, departmental letterhead with just or signed by just me, department letterhead that would be inclusive of the health officer, the president of the board, and the vice president of the board. And in a nutshell, that's what we put together to try to prevent any sort of misinterpretation on the part of the public that any of our releases would have been reviewed by the board in its entirety without us specifically stating that. So
That's the overview. So
Because
this
one of
is- Go ahead,
Sorry.
John. No,
Sorry, I should.
go ahead.
Is one of these categories like statutorily or would you consider like emergency where you gotta just move? So that,
Well, I can go through them all. So the public health advisory was to alert the public to a potential public health concern. This would be things such as extreme heat, cold, excessive flooding, multiple power outages, environmental health issues such as the need to boil water. So these would
Which is a statutory.
okay, so that one category is kind of
albeit some statutory, some not. The public health activity would be just to update the public on an activity of the department. So we're doing an event at XYZ place, and we'd like individuals to be aware of that in the community. The next would be an educational briefing to provide education and or increase the awareness of the public about a particular health concern and or an issue. These would be things such as what we released for COVID-19, influenza, monkeypox, various maternal infant mortality, lead, morbidity, mortality, various other conditions. The next would be the abatement order. These would be the statutory orders here to alert a business of an official Department of Health action related to its or our statutory authority. Those actually would be on Department of Health letterhead and with a wet signature by me. It's actually something I need to talk to you about because we do it with environmental, but have not been doing it with foods. And we've changed to make that we're going to go with foods just to make it all consistent. I thought that would be the right thing. Yeah. Okay, fine. The next would be a required meeting or public notice, and this would be to alert the community of an official Department of Health meeting and a required public notice. And this would go out on Department of Health letterhead without any individual names. And this would be such, the health officer hearings, Board of Health meetings, notice about a petroleum release, other related environmental requirements. And then finally, Board of Health statement. Board of Health would, and this would be a statement drafted and passed with a majority of vote. And statements may relate to specific Board of Health priorities and or policy statements. Our suggestion was that this be released on department letterhead with Board of Health president and vice president listed. And so that would be the only one. And I'm sorry, go ahead.
I was going to say that would be the only one then that would have the board identified on the release. I think after having Bob and his team going through this, I appreciate now knowing these different categories. Like, I think I had them sorted in my head, like I kind of knew, but like having it laid out like this now, we definitely now are very clear about what these different categories are. And then of course, what the procedures are for releasing information and getting it out to the public. So that's my 2 cents about having reviewed this now twice and thinking about it. Yeah, Ellen.
So I guess there are a few issues that I have. First of all, this isn't, I looked over, watched the video of the last meeting, and this isn't what we asked for. It's actually in the minutes too, I noticed. What we asked for was for a list of, I believe it was, it's actually what Heidi asked for, an inventory of the types of press releases that have gone out in the last 30 days. So June 20th to July 20th.
Right.
And we tabled the issue with and it seemed to be with the understanding that we'd get that information and then we could kind of figure out what next steps to take from there. And
if I may
we
interject,
still don't have that information.
if I could interject, right? So
I
the
can give
information,
you all those right now as well.
I was going to say the information was compiled. So perhaps it like leapfrogged a step. So Bob and his team compiled that. Actually, I believe it was Jenny who compiled the information and they gave it to Bob and his team. And then Bob and his team created this.
Yeah, but I guess what I wanted to see and what I was thinking that we'd have when we agreed to it is us, like the actual press releases.
And how
And-
many in each, you want how many in each category?
And not just that, but different types of press releases. And I think besides the daily COVID metrics, there aren't that many. But and frankly, thinking about it more, I think it would probably be more helpful if we had maybe like the past year, because we get some seasonal things that are going on that come out. But I think the step that we need to take is to see what these press releases are and figure out where they're categorized. And then move from there in terms of trying to figure out, is this something where we want Board of Health input for these specific types of press releases or not?
So perhaps I could make a suggestion here. Since Bob and his team did do that work already, categorizing, not for a full year, I doubt it was for a full year. I believe it was for 1 month, right, is what I saw. And then they came up with this. Why don't we send that information back out to the board so you see what they used for that 1 month and how they got to this document. So perhaps it was a step that got leapfrogged, didn't get to see it, that's not as transparent as it needs to be. And then we pick up this discussion at the next board meeting. Okay.
Do you want all of the,
Just what
do you want all of the media? Because every single media release would be, as you saw in the last month, there were
They were
5, 6, 7, 8, 9, 10, 11, 12, 13, 14 media stories featuring the Department of Health as well. And these, and if we can go back perhaps over the year and get every single one, we don't want to do that. There's
No.
It's a lot.
So,
may I suggest, I mean, just for the, can we start with the 30 days first? Because that information is already even compiled. That can literally go out to board members tomorrow. So that way we can start reviewing that, look at that, and then perhaps ask questions from there.
Over the year, but it was a broad categories, is that right? These press releases, this sheet here,
Yeah, that was a year.
that was a year, but it doesn't go over how many, it's just the different types that were done, yeah.
Okay.
yeah.
I agree with that.
Okay. Marcel, with that,
Yeah, I mean, I think
I
let's,
heard a motion.
it's a motion to do what we said we would do last time and then just get that little bit out. If there are more questions, we can take back a year.
So I have a motion to table until next meeting,
Yes.
pending the information from the Department of Health. Do I have a second?
Second.
Is the understanding that we'll discuss the content of this document more in the next meeting?
that would be,
Right.
because then we'll have all the information that the team had when they created the document.
Okay,
Yep.
great, thank you.
Awesome. All right. We need to take a vote. So sorry about that. So all those in favor? Table. Thank you. Any opposed? We have none. We've tabled that item then till next month. So we have a couple of board notifications. We've had 2 hirings. Thank goodness, there they are. Caitlin Bosberg and Catherine Escobedo. Welcome to the Department of Health. They've actually been here already for a month. And then we have had 1 resignation, Susan Burnett, food safety, and she has already been gone for a month, so we wish her well. So now it's time for the public comment section. Public comment may be given in person. I'm supposed to read this statement. Following statement provides guidance for the public comment section. At regular meetings, the public is invited to address the board for 3 minutes regarding items that are posted or not posted on the agenda. Individuals may only speak once during this section. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during this open session. Board president may interrupt or terminate any person's statement if it becomes personally directed, abusive, obscene, or inflammatory. Jenny, will you please let us know who the first person is?
And Carol Nash.
All righty, you have 3 minutes. Go ahead.
Take all 3 minutes, I promise.
Okay.
My name is Ann Carol Nash. I live at Ashmont Court in South Bend in Sable Ridge subdivision. And when we bought our house, we had radon testing too. So that was great. Thank you for that. I just want to say that I am so very impressed with the broad type of work that this department does. And I want to say thank you for everything you do. For 18 years, I worked for the Department of Law for the city and worked a lot on enforcing health and safety related ordinances. And I got a chance to work with our food folks. And that was a real joy. And so that, obviously I knew there was more to the department than that. But just sitting here tonight and hearing all of this and having watched last month, I'm just so very appreciative of all the work you do. I just want to say thank you.
Thank you.
Thank you.
Thank you. Jen, please, you have 3 minutes.
Marla Godet, I live at 55705 Sichuan Drive in Osceola, 45651. They said I passed. I didn't know the language. But you gotta know the language, so I'm gonna go look at that inspection. I wanted to say that with the community health workers, when we say health, we have to start knowing that health is both mind and body being whole, both mind and body being whole. As an advocate for mental health, as a mental health professional, you all know the community health workers position, that is key to me because they are in the streets doing it. You have to understand how much that position is appreciated. When you can, first of all, get the trust of people in certain communities to even let you in, that says a lot about you. And then when you get in, when you do have to get a referral for legal or, I don't know, something that might not present as health related, it is health related. Because when you reduce my anxiety by helping me, you reduce my anxiety, you reduce my blood pressure, you reduce all the other physical things that go along with anxiety. And now I got a whole lot of holistically things taken care of because you came in and you helped me. So that position is huge to my overall health and my wholeness. And so I appreciate that. Understanding today what this gentleman just presented and what I've been trying to tell people, and they don't listen because I'm just a crazy healthcare provider. They don't want to pay attention to me. Ticks, when you all are out here with your children and you want to put them on medication, oh, they have ADHD and they have this and oh, they have all that. And people are, and as a mental health professional, I believe in wholeness. Have they been acting like this quickly, suddenly? Sometimes tick bites cause people to be very aggressive. People don't know that. And oftentimes people jump to behaviors and these things. We have a huge problem with aggression in people in this community. And you don't need to just jump to giving children medication. And no educator should be telling you, oh, you really should get them some medicine. You're an educator. Like, when did you become a doctor? You don't need to be listening to that. Look holistically at your children. Listen to what the health department is saying. Ticks, lead, those are two things that will affect your children emotionally and mentally. You have to pay attention to those things. Thank you.
Thank you. Jenny, no one else. Okay, then that concludes our public comment and we will reconvene next month, September 14th at 4:30 in this room. We're adjourned. Thanks, everybody.
I noticed it after. And I was like, oh.
I'm sorry. It was not the top.
Okay.